Hello nurses, this is Kevin with Nursing KAMP.com, and these are my scribble notes on nursing and the NCLEX. Today's focus is a continuation of heparin versus Coumadin, and I'm going to talk about Coumadin in this sticky note. It's from this study note that's found on Instagram, Pinterest, and nursingkamp.com. And what I'm talking about here is when we previously talked about this is an acute medication. And the reason it's acute medication is it requires specific um, assessment. And it's part of my ABCs, C, D, on priority of medications. And it's one of the A meds. And what we're looking at is Coumadin is also called warfarin. And on a hand-sewn lead, it is the W of that acute meds. All right, so let's talk about it. So why does a person get put on a Coumadin? Well, previously we talked about heparin and how heparin affects on the clotting cascade, and it's an intrinsic factor. Well, the intrinsic means that that's acute. That's the inside of the body, and it's more of non-circulatory. It's a little bit more deeper than that, but the main principle is they can't go home on an intrinsic factor. However, we can deal with extrinsic issues, and Coumadin deals with extrinsic factors, and more importantly, factor 7. Lucky 7. Luckily, we have 7 so that we can treat it and they can go home. Now, patients who are on Coumadin may have previously been on heparin. And so what happens is we start them on heparin, and then we start to check their labs. We'll check their PT and then their PTT. PTT is for heparin. And then what we'll do is we'll start them on Coumadin. And that's called bridge. And bridging is okay. And what we do is we bridge this patient move from this one to this one. Okay, because they can go home on the PT, INR. So Coumadin is given for, hello, how you doing? Coumadin is given for pulmonary embolisms and AFib, and when there is no P wave. See, so and AFib has no P wave, and that means that the atria is just fibrillating. It's just kind of moving around, and it's not conducting to the ventricles. So you see this fibrillation. It's also given for flutter, and flutter has these flutter cutaways, upside down sores. Also for DVT prophylaxis. So if they have a clot, that's in the venous system. See my other lecture on that. That clot can actually go up to their lungs, and that could be a problem. So we worry about that. So let's talk about it. So Coumadin, or warfarin, is monitored through this. This coag. And this is called the coagulation fishbone. You have PT, you have PTT, and then you have INR. Now, PTT looks like an H, right? So that means heparin. Okay? And I covered that in the heparin lecture, so please see that if you haven't. So PTT. Then we have the P10. I talk about this as being 10. Okay, so P10, I just think of it that way. That's 10 seconds. Then there's 1, 2, 3 T's, so 10 to 13 seconds. That's what a PT normally should be, and we monitor that for Coumadin. All right, so INR is the international ratio, and that international ratio is just the way that we monitor Coumadin. You or I who are not on Coumadin, or I don't know if you are, but if you are on Coumadin, we should be 1 to 10, 1 to 2. That's a normal finding. So if they're on Coumadin, we want them 2 to 3, and that means they are called therapeutic, and that's a good thing, so they're good to go. All right, 2 to 3 is normal, and then 3 to 4 is valves. So if you have a prosthetic valve and it's foreign, well, the problem is that you got all these chordae tennae dealing with it, and what happens is they can get microemboli. And they can throw clots a lot frequently. So we're very worried about this. So patients with valves, we want a little bit more coagulated because we don't want them to form these clots, because these clots can go into the lungs and then they can cause a PE, and then that patient can, die. And rule number 1 of nursing is don't kill patients, right? So we keep them on 3 to 4. That's okay for a valve. But if they don't have valves and they're 3 to 4, we start to worry, okay? Greater than 4, no more Coumadin. You stop the Coumadin, generally, follow policy, and then give them vitamin K. Okay? And that's the antidote for Coumadin. So how that would look is that, a quick run through on my coagulation fishbone. So you have this, you have the PT, you have the INR. Nope, sorry. You get the PTT and then INR. So 10 to 13 seconds. Okay, if they're coagulated, it should be increased. Okay, but we mainly look to the INR. You and I, who are not on Coumadin, are 1 to 2. 2 to 3 is where we want them. That's okay. And if they have a valve, 3 to 4 valves. Greater than 4, no more Coumadin, give them vitamin K. And that's the antidote. Vitamin K also has like spinach and stuff. So they have to watch spinach when they're on Coumadin. Green leafy vegetables. No salad stat. So Coumadin, So Coumadin is a specific medication given for anticoagulation for ongoing. They can go home. We monitor their stools. We make sure that they know about green leafy vegetables and those type of things. So let's go through the AWALS, which is a method that I use to evaluate knowledge of all the content areas and what I might need to study. First thing is it acute or is it chronic? Well, it is acute med because you have to monitor the PT and INR. And also there is an antidote, so which vitamin K is, and so that's acute. How does it work? Well, it works on the extrinsic factors, right? Factor 7 more specifically, and that's why they can go home. There is another medication, Eliquis, right? Eliquis and Pradoxor. They work on factor 10. Now, that's it for another lecture. It's not really tested on that much because it's a newer medication, but you do see it in practice. When do we hold it? Well, signs and symptoms of bleeding. So you're going to have this person use a soft brush toothbrush. You're going to have them not eat salad, no green leafy vegetables, no spinach, because that's all has vitamin K in it, and that could have a problem with that. If you see signs of bleeding, then you hold that medication. Or if the INR is greater than 4, you hold that medication. So what's the assessment of bleeding? And also INR and labs. So the labs are the coagulation fishbone, eating, we talked about, salads. And what stands out? Well, when you're thinking about Coumadin, Coumadin is a bridge medication. They usually start on heparin first, and then they get bridged over to Coumadin. Once they're on Coumadin, they need blood work, and they need to be monitored for the PT-INR to make sure that it's in therapeutic level. And 2 to 3. If they have a valve, it's greater than 3 to 4, and greater than 4 is no more Coumadin and give vitamin K. Well, my name's Kamp, and this is Nursing Kamps. This is from my sticky note on coagulation medications. You can get it on Instagram, Facebook, Pinterest. Say hello. You can also purchase my books on Etsy, but they do come free with NursingKAMP.com as a member. So that's about it. See you next time. Nurse on and be that nurse. Bye.